Welcome to Microdose Psychedelic Insights, powered by the Conscious Fund. This is the In Cognito series, casual psychedelic conversations on cognitive liberty.
Thank you, Mr. David, for joining me on another episode of In Cognito. It's been a little while since I recorded one, so I appreciate you coming on.
I've been looking forward to it. Thanks, Patrick.
Yeah, absolutely. Why don't you take a minute to introduce yourself, just tell us about the work that you do and how you got involved in psychedelics generally. Just kind of an opener.
Happy to. Worth zooming back to my mid-20s and starting to explore psychedelics, and like many of us having beautiful eye-opening experiences, pretty quickly followed by a couple of back-to-back very challenging journeys. And I found myself honestly scratching the surface of insanity. I just had a 4 or 5 hour complete break in what it felt to be me and whether I even existed. And I don't like to necessarily draw a comparison to that between that and the holy grail sort of ego dissolution experience that everyone's out there looking for, because this is certainly not something that I think anyone's looking for. But and on the second of those two journeys that were challenging, I did almost take my own life because I was experiencing so much trauma all in one sort of flood that I felt the only way to end it while I was in brief moments of lucidness was to jump off of the 24th floor balcony, and thankfully didn't do that. But I certainly gained a lot of compassion that day for what it might be like to have a mental health and neurosis or something like that, and came out of it, journaling and integrating for several months and going into a very inward space where I recognized I wanted to help people with mental health trauma, mental health conditions, and also to explore further why the psychedelic journeys I'd been on had previously been so beautiful, but then in these cases had gone sideways, so to speak. And I had been training with Zendo camp at Burning Man and then beyond, and had sat and held space for now it's like dozens of people, and just witnessing firsthand how different people respond to what they call the challenging trip. So I've gained more awareness and more context, but it was only in middle of 2018 where I was invited to co-lead the Denver psilocybin initiative. So we helped Denver be the first city to reform psilocybin mushroom policy. And through that, I was out on the streets, quote unquote, meeting with people who were using psychedelics for very different reasons than the average festival goer. And that really opened my mind to the medical benefits and just how many different use cases there were to explore and really to understand psychedelics more deeply. So started a nonprofit with two great partners of mine here in Denver, and we created a collaboration with Johns Hopkins University with Roland Griffiths and his team, looking at this idea of set and setting. So rather than exploring the science of the drug, exploring the science of the journey and actually understanding what contributes to a positive health outcomes or harmful health outcomes as part of the journey. And building that study had me out there talking to many, many therapists and practitioners, clinicians, shamans, space holders, and learning that it's not just the scientists that want to investigate these kind of problems. It's not just Roland Griffiths and Robin Carhart Harris and these academics that want to understand how psychedelics can be administered safely. It's really all of the practitioners in the world that want to understand how they can be offering the safest, most effective containers with these drugs that are really difficult to understand. And so this is where the inspiration for Maya came up, and I'll share more about Maya, but perhaps I'll pause there.
For sure. Yeah, no, I'm really happy to hear that you made it through that challenging experience. The world needs more people in it that are kind of helping other people get past that. So when you had that experience, I'm assuming it was a psychedelic experience that you were going through. Was there, compared to your previous usage of psychedelics, was there an intention, or a different intention for you in that, or did it just happen to kind of trigger into that kind of an experience?
I had been in a good practice of setting intentions whenever consuming a psychedelic, and it was always in the container of sitting down, whether I was with one person or a small group, and setting intentions and having that almost ceremonial container, even if it was a quote unquote recreational experience. Interestingly, though, that first journey, and it was on 200 mics of LSD, and it was a journey that was intentional and certainly set up for success in all the ways I knew how. But what I hadn't factored in was that every psychedelic trip I had taken up until that point, which was several dozen of them, was with my partner at the time. So my romantic partner was my inbuilt trip buddy, if you will. And this was the first trip where I wasn't with her, at least not for the second half of the trip. And that was what set off a downward spiral in my psyche. And, to double click on that, we actually started the container together because we had maintained friendship after moving in separate directions. We were in a small group of 6 or 7 and together set intentions. And that first 4 hours of the journey was very beautiful, very constructive, very full of love. And then she left and went off, on her own path. And it was 15 minutes later that the inner shadow of that breakup and the heartbreak and all of it being very fresh that I hadn't fully processed yet started to pull me in a direction that I wasn't expecting. And we're talking to the point where I put my hand on the ground and I felt, okay, if my hand's on the ground and the ground is horizontal and this feels horizontal, then I must exist. And then I lost the concept of horizontality altogether. And to that extent was just lost in time and space. And that lasted for several hours and could have been quite dangerous, but thankfully instead led me to a very sage, wise friend who guided me out of that journey and then told me about Zendo Camp and helped me kind of learn that there was this whole concept of harm prevention and this idea of really taking care to set up the parameters for a psychedelic journey for success. The way she put it, which is beautiful, is that when you're deep in that space, you're down at the core of your earth, so to speak. And if you imagine that you're not well nourished, you're not protected, you're not in a safe space, or you're not hydrated, then you can easily stumble and kick a pebble or a stone by accident. And what's happening on the surface is that could shift an entire continent. And you never know if that's going to be permanent or positive or not, and or harmful. And it was really that moment that had me snap into attention that these compounds need to be taken really seriously. And more importantly, the container that's set for these journeys needs to be taken seriously. And that is a segue into the work I do now. I believe that psychedelics will be embraced in Western medical healthcare in the coming years. And we're not talking decades, but years. And at the current trajectory, the medical system is not set up to successfully hold that space in the complexity of a psychedelic journey, whether that's MDMA, psilocybin, or of course, ibogaine, 5-MeO-DMT, ayahuasca. So yeah, I feel very committed to helping the Western system become prepared through better data, better understanding from the evidence of really what works and what doesn't.
Yeah, no, it's beautiful and it's really, really important work, these are so individualized in the sense that everyone has a different journey and a different experience. So really understanding that, the fundamental precursor of mental health when you're moving towards powerful psychedelics, I think it's super important. So I commend you for that. Before we move on.
And the work you're doing with Microdose is equally shining light in all of these areas.
Thank you. I really appreciate that. Before we move on to sort of the next, and I feel like it kind of ties in nicely with what you're doing, sustainability. I like to ask, I forget every once in a while, but I'm remembering it today. What's your favorite psychedelic and why?
I think that having experienced more or less the full range of psychedelics, I haven't yet been in an iboga or ibogaine container, but otherwise, for the most part, of course, without taking into account the thousands of derivatives and so forth, I'm, fairly well experienced. And what I've found is that in the right container and with the right approach, ketamine can actually open up the same type of experience that comes from many of the other compounds once one has experienced those other compound journeys, I feel like a similar space can be achieved with ketamine. And because ketamine is much shorter, faster acting, shorter lasting, and it doesn't necessarily require the same level of sort of multi-hour ceremonial setup that it can, in my life, in a way of using ketamine intentionally to meditate on a specific topic or to really contemplate some major decision in my life, I found that I can use it very effectively. And because it's so versatile, I would say it's very powerful. But I do think ketamine is misused most of the time. And I think it can take years to get to the point where using ketamine really effectively is the case. My very close friend and person who runs our podcast, the Psychedelic Therapy Podcast, Eamon Armstrong, put this really wonderfully in an interview he was doing with Bessel van der Kolk. And he said, if so many people are tempted to the ontologically masturbatory experience of ketamine, where you go out there, you sort of experience something so beautiful and grand and cosmic, and then come back and it doesn't really necessarily provide any major lesson, or the parameters haven't been set up well to take away a growthful experience from it. And I think that's very true. And I think it can be used well.
Yeah, for sure. And thankfully, ketamine is really like hitting mass cultural adoption, I think, especially in the States. It's one of the first legal psychedelics and really making room for a lot of others to be studied and, accessible. So kind of trailing that thinking and, your core business mission here into the psychedelic space for the, next chunk, I'd like to talk about psychedelics and generally just start it with sustainability. And I started with an open-ended question, like, when I say sustainability to you, what does that mean? And it doesn't have to be about psychedelics or the environment or anything, but just in general.
Big question. What comes straight to mind, interestingly, is the community that's currently seeding the psychedelic movement has shown signs for several years of being quite cannibalistic. And I'm finding it really hard to hear people either with chips on their shoulders or with understandable, past experience that leads for them to have a very strongly held conviction about how this space needs to evolve, really approaching others with vitriol and superiority. And it's such a shame. And you would think of any industry or any community that this would be the one that shifts that paradigm. And it's not quite happening, unfortunately. And I think that the first thing that will prove the psychedelic healthcare or psychedelic mental health space to not be sustainable is if this very nascent community isn't able to at least provide a respectful container for all voices to be heard and acknowledged. So I think that's one area that needs to be looked at more closely. And I wonder how the right kind of platforms could be created so that folks with differing opinions can still have their voices heard, still make their impact in the way that they're hoping, but not at the detriment necessarily to others. And I also, of course, look at the sustainability for the medical system. And one theory I have is that, or maybe it's more of a thesis, that if all things continue on the current trajectory, the love affair that the press has with psychedelics, that thankfully Michael Pollan seeded, and Rick Doblin is helping usher, and many other people are fueling with positive research results and positive reports about psychedelics, and then the whole psychedelic tourism and ayahuasca culture is enough for the press to speak very positively. But that's not that sustainable. The readership will start to get bored of those kind of stories in the coming couple of years if something doesn't either dramatically change, or if we're not careful about the way those messages are being presented. And so I have a bit of a fear that if the press changes its tune and starts to focus on the scare stories as they did back in the 70s, if any kind of propaganda is able to inform the press's reporting on this topic, then we could very easily see a reversal of all this progress. We could start to hear the sort of cultural rumors and murmurings that that psychedelics do make you chop up your roommate with a chainsaw and try to eat him, kind of thing. It was stories that I was hearing in the 90s, and if that happens, we'll all have to do this work again in 40 years. So I hope that there can be enough evidence built up over these coming 2 years that when used correctly, when used safely with the right parameters for the right people, psychedelics are demonstrably safe. And there's no refuting that. Here's the evidence, here's the data-driven knowledge set showing that psychedelics can be used safely, and a data set showing that harmful outcomes do occur, but they're only in these types of containers where there was either misuse of the drug or there was irresponsible action by the guide, the therapist, what have you. And I think if we can demonstrate when those harmful outcomes are occurring and how I think minimally they occur, really, when the right attention is paid, then in a year's time there'll be all of that narrative to share with the public and sustain the space for longer.
Yeah, and almost avoiding this, like, I like what you mentioned originally there, almost like an air of absolutism. You know, if I'm here doing my thing, I'm right, you're wrong, and I got to prove it, so get out of my way, right? Like, that didn't really work too well in the cannabis industry. It doesn't really work that well in any industry. And, you know, while I agree with you, I've also noticed one thing, and maybe, you know, it's an individual thing, or maybe it's the people I'm talking to, but what I've seen and found is that people really do have a little bit less ego involved in these decision-making process, and that, you know, in sort of those goals and decisions. So, you know, while there might be this like absolutism of methodology, getting to the ultimate goal seems to be generally driving a lot of people. So it's like, we got to sort of balance and toe, and that is really sustainability, right? Is like, you know, making sure that you balance the good and the bad and come towards, you know, a solution really together. And so fingers crossed that can happen here. I think we can pull through and kind of band together as a nascent industry, but it's going to take a lot of open communication to get there, I think.
Yeah. Yep. Open communication, open-mindedness. I think recognizing that as a species, we can all learn more if we have different tribes and members of this species pushing on different buttons and exploring different pathways, and not all just doing the same thing. And even if somebody who believes that psychedelics should only be accessed when grown organically in the ground in the form of mushrooms or cactuses, for example, and that anything done in a lab is bad, even if that's a strongly held belief, at least acknowledging that as a species we'll learn more about the mind and the biology and the biology of this whole space if we have different people investigating different ways of approaching psychedelics.
Yeah, for sure. And I mean, you're allowed to be right and you're allowed to be wrong, but you're not allowed to command what somebody else's opinion should be. Like, and I see a lot of that. It's like, well, no, like, I think this thinks you're wrong. And it's like, well, actually, no, like everyone's got an opinion, and, you know, these things should be loosely held, I think.
It's a fascinating philosophical question. It goes back to the Middle Ages, when early religions were being spread through, you know, or different subsects of existing religions were almost battling for territory throughout Europe. And there was this shift, I believe, I don't know when exactly it happened, but I remember reading about a shift from the general paradigm, I believe, in the Roman times, being that if your neighbor doesn't believe something, then they should have their own beliefs and you have your own beliefs. But then a shift happened where it became seen as unethical not to help your neighbor see the world the same way you do, because of course, if you think that's the best way to live life, maybe the most virtuous way to live as a human being, of course, it's your responsibility to have everyone else do it the same way. And I don't think as a species we've solved that one yet.
Definitely not. Perfect carryover to the third conversation topic, though, the art of being incognito. And so I always read off the two definitions, thanks Google. being incognito means the philosophical principle that one's exists is demonstrated by the fact that one thinks or the intellectual process of the self or the ego. So when I sort of just, drop those two definitions of incognito, how would you say you use that art or practice in your life?
Mm-hmm. Rein me in if this is tangential, but I remember 5 or 6 years ago, back to back, reading 2 books, which I'm sure many folks in the audience have read. One was The Surrender Experiment, which has this this wonderful story of the author Michael Singer having become more or less an ascetic, moving into the wilderness and the forest and just meditating every day, and speaking several decades on from his private jet, where he had just, on his way to sell his business for $200 million. So it was telling the story of how simply surrendering to the beautiful forces of the cosmos and, as it were, enjoying the show rather than trying to manipulate the show allows someone to be in more peace, freer of suffering, simply accepting what comes. And if one is living in that level of harmony, let's call it, with the universe, then only good things can happen ultimately. So that was that philosophy. And then the next book I read was Biocentrism, which, on the recommendation of Sam Harris, was this philosophy that, as the person who's at the center of my universe, I'm there creating everything that's happening subconsciously and consciously. And that through will, there can be any life, right? And honor and kindness, as well as knowing that I have the ability, like Steve Jobs once said, to, push on the sides of the balloon we're living in and change its shape and have more space to live in. And I'm fascinated by both approaches, and ended up finding that I could, once I understood each of them well enough and had really practiced each of those mindsets, I was able to choose one or the other in different moments. And it's an area I'd love to spend hours in discussing and theorizing with you, but this concept
podcast.
Yeah, exactly. I think ultimately my belief is that I have the choice, because if I'm choosing to surrender, as it were, and be a passive observer, then that's still, in my eyes, me choosing to do that. So there's a bit of a meta-analysis there, but I don't have it figured out. I have been enjoying playing in both territories. I
think that's a bit of an inside joke. Nobody has it figured out just yet. It reminds me of a quote that I really like, and I try and think back to it when I'm on either side of the spectrum of excitement, and it goes all the way back to Shakespeare. It's tis neither good nor bad, but thinking makes it so. And it's kind of a nod to both of those, where it's like, look, things are happening. Because you're in the middle of all of it, you're going to choose to dictate positive or negative emotion to that occurrence. But it's not to say that you thinking about it is changing that occurrence. It's not good or bad. You're making that up in your head a little bit, right? So it kind of like tails into that philosophy of it's going to happen anyways, I have to say this
takes us back to the original topic of the challenging trips that I had. Could I take a moment to share another piece of that?
Yeah, definitely.
So in the second experience out of those two, and by the way, those two were 6 months apart, and I hadn't taken any psychedelics aside from an ayahuasca ceremony in that 6-month period. But I don't think, maybe I'm misremembering, but I don't think I had. This is the challenge, is that a couple of years ago I decided I'll never tell a lie, and small or big, never lie, just have full integrity with my word. And but it does mean that sometimes I just don't remember, and I don't want that to be perceived as lying.
Yeah, which
So I'm in this journey, and I have to say this was on more than just LSD, right? I had taken in LSD, 2CB, and psilocybin. The thing that actually kicked it all off, because all of that was going fine, but then one hit from a cannabis bong was what sent it flying. And it's interesting, I'm not a cannabis user despite building a big tech company in the cannabis space for 4 years. And it's not a compound I'm familiar with. I was told that if I took this little drag, then it would, calm my nervous system and I could just settle down and we could go to sleep. Quite the opposite happened. And as part of that, when it was really in the depths of the experience, I realized that each moment, call it a millisecond, microsecond, each just moment was being split into many versions of itself. And it's very hard to put this in a way that makes sense because it honestly defies the laws of time. But it's almost like I was able to experience a spectrum of different versions of each moment. So take a second where I'm looking at these two friends that were there trying to care for me. And on one end of this sort of spectrum, as it were, was them being intimidating, having the negative intentions for me, the prospect that they were really imposters and that they were there to harm me in some way. Then other examples where I was more concerned for them and their safety, or I was interested and curious about what they were thinking, and then on the other end of the spectrum, just full love and nothing but open hearts for them and their care for me. And literally visually, the entire scene was changing. Their facial expressions, the light in the room, the way that the shadows were bouncing, that kind of thing. And I was experiencing each of those in succession, not necessarily at the same time, but they were all folded into just one single moment, and then that would disappear, and I'd be into the next moment.
Available to you at a moment.
Exactly. And after this had been going on for a couple of hours, during which, as I said, I almost threw myself off a balcony because it was too confusing. There was just this one moment where I said, I choose this one. And it was the first time really in my life I had recognized that I have a sentient choice over how I'm perceiving any given moment. And taking that into the subsequent months and years and realizing that I might not be consciously perceiving that that's going on at all times, but somewhere in my psyche, that's exactly what's happening. And I'm choosing each moment. I don't know that I'm doing it. Maybe I'm choosing based on just what's been happening that day, or triggers that are playing out, or things that are making up the dynamic of my month. But in knowing that deep down somewhere, I am actually making that choice every single moment to perceive how people are looking at me, what they're thinking about me, whether the room I'm in is comfortable and appealing and safe or not, is a really powerful upgrade to the experience of life, and maybe to the nervous system. So I'm so grateful for that.
Beautiful. Gotta love it. Is there anything else before we wrap up that you feel like you wanted to share, or anything that we kind of missed, or any philosophical last minute insights that you've got for us? It's been a very meta podcast. I like it.
Well, no more philosophy, but I will say that for anyone listening who's interested in the safety of this space and the sustainability of psychedelic ceremonies, psychedelic treatments, psychedelic healthcare, I'd be honored if you would take a look at what we're doing with Maya. I believe that capturing data on the best practices and all the many, many myriad types of practices that are showing us what works and what doesn't for different types of psychedelic treatments and different types of participants, there's going to be fascinating insight coming from that data. And if anyone is interested in that approach to the psychedelic space, you can read more at mayahealth.com. But I'm also running a psilocybin study for our nonprofit called Unlimited Sciences. And this is a study that's open for anyone who's planning a psilocybin journey. And if you want to contribute to the science through a nonprofit and through Johns Hopkins University, going to unlimitedsciences.org and participating is much, much appreciated. We have about 3,000 people in that study so far, so it's going really well. And just the more data we can capture from around the world, we'll then present that back to this community and show some of those details that are found about what aspects of set and setting make the biggest difference, positive or negative, to the psilocybin journey.
For sure. Yeah, I would
you letting me have a moment.
Second that on Unlimited Science. They're doing amazing work. And last but not least, Mr. David, where can people find you? Should they DM you on Twitter, reach out by email? What happens if people still want to talk?
I welcome any emails, david@mayahealth.com. That's MAYA.
Perfect. Thank you so much for coming on, David. I really appreciate it. And I look forward to publishing this and sharing it with our audiences.
I've really enjoyed it. And it's great to see you, Patrick. Thanks for all the work you're doing and for hosting this space so we can all share our stories and engage with your audience too.
Absolutely. Happy to be doing so. Thanks, David.
Thanks for joining the Incognito series, brought to you by Microdose and the Conscious Fund. Visit our website at www.microdose.buzz.